Welcome back to Good Day Son-in-Law. Well, June is Men's Health Month, and we have here for more insight is Dr. Brian Smith at Rapides Regional Medical Center. Dr. Smith, thank you for joining us today.
Oh, thank you for having me.
Of course, of course. So Men's Health, it's a big awareness month for y'all. So tell us a little bit about some of the facts about men's health that might even surprise us.
Yeah, sure. So in 2013, we started the No Shave November as a way to bring attention to men's health. Just try to engage men into being a little more proactive in their health early in life, but also the preventative things. In Louisiana, men are much higher likely to be obese than other areas of the country. I think men over 20 in Louisiana are between 40 and 50% have obesity.
Wow.
I think 50% of men over 20 have hypertension. Okay, hypertension untreated leads to strokes, heart disease, kidney failure, dialysis. Things, and it's something that we don't feel, and so you need to have that screened and you have that checked out. Of course, men are much more likely to engage in more dangerous activities, not just crazy off-roading and jumping out of airplanes and whatnot, but smoking, drinking, using drugs. Much higher risk than women, and so those are some things that lead to higher health problems for men. Men have about a 5-year difference in life expectancy for women. We're going to live 5 years less overall because of not getting good, adequate early health care, preventative care, and some of the crazy things that we do. My experience is men tend to show up at the doctor's office when something's been hurting for a long time, or their significant other has nagged them to the point of showing up to get something dealt with. And really the best thing is to get preventative care. Start when you're a young adult, go yearly, get preventative care. 1 in 2 men in their lifetime will get some form of cancer. A lot of those are preventative. Colon cancer, early detection of prostate cancer, avoiding smoking so you don't get lung cancer. A lot of those things can be dealt with good preventative care and some good life choices. Of course, the wisest thing is what are you putting in your body? Are you eating healthy? Are you exercising? Are you getting good rest? I mean, all the things that your mom told you, but those are true, those are real. Those are the things that will increase the likelihood of you living a long time. I mean, that's really, we want to not only live a long time, but we want to live and be healthy and enjoy our later years. And so my encouragement is for men to get out, get you a primary care physician, go yearly, get that preventative visit. An annual wellness visit is free for almost anybody with insurance. So take advantage of it. Get the preventative screening tests that are out there. Men at 55 need to start having a yearly prostate evaluation. We need to start colorectal screening at 45 and not 50. You see these commercials now for Cologuard, there's colonoscopies. There's really no good excuse to not get colorectal screening, and to be able to live a long time without major problems. I really feel that that a lot of steps can be taken just by going for preventative care. We need to make better choices, minimize the amount of alcohol we're drinking, smoking, there's nothing really good about that. So making those choices, those are some tough things to deal with, but we know that they're what are healthy. And so men are also at very high risk of suicide. I know we talked earlier about injuries and drowning, but men also have, because of some of the high risk behaviors that we have, high stress life, and not getting the mental health care that we need because of stigmas, because that's not the manly thing to do, whatever the issue may be. Men are much higher likelihood of suicide than women are.
Wow.
And so I encourage men to take their mental health issues seriously. Go to your primary care physician. Get the help you need. There's no shame in getting help when you need it.
Absolutely, absolutely. Well, Dr. Smith, thank you so much for joining us on the show and giving us some great advice about Men's Health Awareness Month for the month of June. We appreciate it so much.
All right, thank you.
Of course, we'll be right back with more Good Day Sinlaw after this break.